Good afternoon, everyone, and welcome. Thank you for joining us today. This session is brought to you by Project Firstline Rhode Island under the Rhode Island Department of Health in partnership with the CDC. Before we begin, I'd like to direct your attention to the chat and introduce Abby Anderson, who is our Project Firstline Rhode Island assistant. Abby will be posting information for you guys throughout the webinar via the chat, such as the pre-session survey. Please take a minute to answer the survey if you haven't done so already. My name is Jacob Figueroa. I'm an infection prevention training liaison for Project Firstline Rhode Island. Now, I'd like to introduce Dr. Kearney.
Good morning, everyone. My name is Alexis Kearney. I am the Consultant Medical Director for Project Firstline and super excited to see all of you here today. We'll be in the background answering any questions.
Thank you so much, Dr. Kearney, and welcome. Like Dr. Kearney says, the Project Firstline team is also behind the scenes in support of this webinar. Now, if you would like to, please introduce yourself in the chat by telling us your name and your organization. Thank you, everyone. I'm glad you could all make it. So we are excited here to be with you today to present a quick IPC refresher on blood. This session is for all healthcare workers, including healthcare workers in clinical roles, as well as those of us that are in non-clinical roles. This session will be interactive with scenarios, so please feel free to use the chat feature to share your experiences and knowledge with your colleagues. Let's begin. So let's take a moment to go over our continuing education criteria for those of us that are interested in CNE credit. This is a 30-minute session that is approved for 0.5 CNE by the Northeast Multi-State Division of Education Unit, an accredited approver by the American Nurses Credentialing Center's Commission on Accreditation. To receive your CNE, these 4 steps must be completed. Step 1, please complete the pre-session survey prior to the start of the training. My colleague Abby has been adding the link in the chat and will do so again. If you haven't done this, please take a moment to complete this now. The survey will close at the start of the training. Step 2, the second step is to attend this live training. Thank you all for coming. Step 3 is completing the post-session survey. The post-session survey will be emailed tomorrow. And step 4 is to complete the post-session quiz. A link to this quiz will also be emailed to you guys tomorrow. For our other healthcare colleagues here today who are opting for certificates of training, EMS continuing education, and dental IPC continuing education, items 1 to 3 here are required, while the post-session quiz is totally optional. Let's begin. So here's today's agenda. We've done our welcomes and introductions. We'll go over our learning objectives. Then we'll learn about exposures in the healthcare setting, as well as infection control actions we can take when encountering blood. Throughout this session, we'll work through case scenarios. And at the end, we have announcements, end of session feedback, and our live Q&A. So here's today's learning objectives. Know how to apply standard precautions to prevent blood and body fluid exposures. Understand the importance of using standard precautions, including cleaning your hands and wearing appropriate personal protective equipment when handling blood. And review how to handle and dispose of sharps safely to avoid bloodborne pathogen exposure. So let's start with learning about bloodborne exposures and why this is such an important topic for all of us in healthcare. In healthcare, it is not uncommon to take care of patients with bloodborne infections. People who are infected with bloodborne pathogens don't always have symptoms, but their blood can still have the virus in them and transmit them to others. Exposures in healthcare can happen via an accidental sharps injury. For example, this can be a first responder administering an injection to a patient. The patient has a sudden movement and the first responder gets stuck with the needle. That creates an exposure. Also through non-intact skin, like an abrasion or a cut or a blister. This can be an EVS personnel that is cleaning linen with blood in it. They have a small cut in their thumb, they're not wearing gloves, and they pick up the linen with their bare hands. That creates the potential for blood on the linen to enter the body via the non-intact skin. And through the mucous membranes, like the eyes, the nose, and the mouth. This can be a nurse helping during a trauma situation. They have gloves on, but they forget to don a mask and other PPE. There's a droplet of blood that gets into their mouth, the mucous membranes, and that creates another exposure. anyone in the medical field handling sharps or waste is at risk for exposure to blood-borne pathogens. When caring for patients, we should think of blood as being infectious and always act with this in mind. These actions that we take are part of standard precautions. Standard precautions is about looking at a situation, anticipating the risk, and then taking the appropriate actions to prevent harm. This includes selecting appropriate PPE, knowing that there's potential for bloodborne pathogen exposure through a task that we're doing. By using standard precautions, we can prevent transmission of bloodborne pathogens like hepatitis B and C viruses, as well as HIV. These viruses account for the majority of occupationally acquired bloodborne infections in the healthcare setting. So the way that this session is set up is that we'll first start off with scenarios that then will lead us into the infection control actions that we'll learn more about. So let's start off with the first scenario. You've finished drawing a patient's blood. The needle, syringe, and other devices used have been discarded appropriately into a puncture-resistant sharps container. After removing gloves, what is your next step? Please feel free to put your answers in the chat. So after removing gloves, there's a step we must always do before moving to the next task or the next patient. Think about what that action is, and if you're comfortable, please write your response in the chat. I'll give you guys a few seconds. So I am seeing a lot of hand hygiene, washing your hands, very good. So we know that the likelihood of encountering blood is high when drawing blood. Gloves offer an enhanced level of protection, but they are not perfect protection. After completing the task and removing gloves, we will clean our hands to prevent the spread of pathogens to the environment or to the next patient. Great job, everyone. Easy enough, right? So for this section, we will focus on hand hygiene, also known as cleaning your hands. Hand hygiene means cleaning your hands by using soap or water or alcohol-based hand sanitizer. By cleaning hands, healthcare workers reduce the risk of transmission of bloodborne pathogens to themselves and to others that may be picked up from different tasks. It's important to know when to clean your hands with soap and water and when to use alcohol-based hand sanitizer. So in a previous scenario, let's say that after you remove your gloves, you notice that there's blood on your hands. You will use soap and water to wash your hands, and if your hands are not visibly dirty, it's acceptable to use alcohol-based hand sanitizer. On to our second scenario. In the emergency department, you are caring for a patient that has fallen from a bicycle. You see that the patient has a 2-inch arm abrasion that is oozing blood. What PPE should you use while cleaning the wound? I'll give you guys some time to answer. Please write your response in the chat. Now remember, the selection of PPE is based on the nature of the patient interaction and the potential for exposure to infectious material. So the blood here is oozing and it isn't spraying or splashing. So we would use gloves when coming in contact with blood. Nice job, everyone. I'm seeing a lot of gloves. Thank you. So in this next section, we will talk about using gloves if we're going to touch blood. Gloves reduce the risk of blood contaminating the hands. We should use gloves when anticipating contact with blood or other potentially infectious material, mucous membranes, non-intact skin, or potentially contaminated skin or equipment. After completing your task, remove gloves right away and clean your hands. It's important to select the size that best fits. So not too tight where it would be uncomfortable and possibly tear, and also not too loose where the gloves reduce your dexterity and potentially increase your exposure risk. Although gloves are the first item of PPE discussed here, they are often the last piece of PPE to be put on when other PPE is worn. And when it comes time to take off your PPE, gloves are usually the first item to be removed. The reason is that gloves are typically the most contaminated piece of PPE, and you don't want to accidentally contaminate other areas of your body while you are taking the rest of your PPE off. Always remember that gloves are not a substitute for hand hygiene. Clean your hands before putting on gloves and after taking your gloves off. On to our third scenario. During change of shift report, you notice a patient vomiting blood on the floor. What PPE should you use? So in this scenario, the patient is vomiting blood. So blood droplets are splashing and spraying. So let's think about where these droplets can land. The droplets can land on the clothes that we're wearing, right? The exposed skin, like our hands and arms, and even on our face. So with all this in mind, what PPE would we use to protect these areas? And I'm seeing a lot of good answers. I see gloves, gown, eye protection, booties, full PPE, very nice. So thank you all for your responses, outstanding. So this next section is dedicated to using the right PPE if splashes and sprays are likely to happen. So we've just reviewed gloves. Next, we'll go over gowns, face masks, and eye protection. A gown protects clothing and skin from contamination. If any blood touches your clothing, it can soak in and get to your skin. And if you have any cuts or scrapes, there's a chance for transmission. We would wear a gown when in contact with a patient's non-intact skin, during a procedure likely to generate splashes or sprays, and when handling patient fluid likely to leak or splash. Next, we have face masks. Wear a mask to help keep droplets of blood from reaching the mucous membranes of the mouth and nose, and discard disposable masks after use. And then we have eye and face protection. So goggles provide protection to the eyes, and a face shield will offer protection to the entire face. Wear eye and face protection if blood and body fluids may splash during a procedure. Additionally, it's important to remember that personal glasses are not adequate eye protection. You want to make sure that you use goggles to protect your eyes. So going back to our patient that was vomiting blood on the floor, we'll use a gown to protect our clothing and skin, a mask to protect our mouth and nose, and eye or face protection to protect our eyes. Then you'll doff PPE safely and appropriately. This means removing PPE carefully before leaving the room, typically at the doorway of the patient area. A mask can be removed right outside of the patient's room. If PPE is soiled with blood, discard into a biohazard waste receptacle. And lastly, clean your hands immediately after removing the PPE. By wearing appropriate PPE in situations where splashes and sprays are likely, you can significantly reduce the risk of exposure to bloodborne pathogens. On to our next scenario. So, November is National Diabetes Month. We've added this scenario to highlight the importance of safely handling glucometers, insulin needles, and other sharps when caring for patients with diabetes. You are preparing to obtain blood glucose test and administering insulin to a patient with diabetes in their home. How would you dispose of these sharps? So let's think about what's happening in this scenario. We'll be using a single-use lancet to prick the skin and obtain a blood sample for testing. And depending on the glucose reading, we may draw insulin through a vial with a needle and syringe, for example. So with all this in mind, how would you dispose of these sharps? Please write your answers in the chat. I'll give you guys a few seconds. Very good. So I'm seeing a lot of sharps containers. So we'll dispose of the used lancets and injection equipment at the point of use in an approved sharps disposal container immediately after they've been used. Never reuse lancets or needles or syringes. These devices are designed to be used for one patient at that one time. And once we're done, we'll take off our gloves and perform hand hygiene. And additionally, let's take this opportunity to educate our patients on safe sharps disposal at their home. For example, we can educate them on having a sharps container to safely dispose of their sharps instead of a regular trash to avoid risk of injury to themselves and to others. Very nice job, everyone. So this last section is called Look for Sharps. And here are some considerations when handling sharps. First, when you're using sharps, you want to plan ahead. Pick one location to keep sharps in before you start a procedure so you can keep track of them. Have good lighting and communicate with those around you that sharps are being used. And keep exposed sharps in view and under your control. Also, be aware of surroundings and look for sharps. Be careful when handling linens or other items that might be hiding a needle or other used sharps. Injuries can occur when sharps are being left behind. Third, use built-in safety mechanisms. These include needleless systems and needles that retract. Know how safety mechanisms work before use. And if you don't know how to use them, ask. And fourth, never recap needles. Trying to recap or manipulate sharps can lead to accidental needle sticks. If you encounter improperly disposed sharps, handle them carefully. Keep your hands behind the sharps, and if the sharp cannot be handled safely, you can use a mechanical device to pick them up. So for example, you can use tongs or forceps to pick up and dispose of these sharps. So, and even before using sharps, we're going to make sure that we have a sharps disposal container that we can safely use. Objects that get discarded into these containers are medical instruments or materials that can cut or puncture personnel. After use, sharps should immediately be placed in a sharps container. These containers are designed to prevent accidental needle sticks, are puncture resistant, and are near the point of use. Lastly, do not overfill these containers. Overfilled containers increase the risk of accidental injury. Replace containers when about 3/4 full. To prevent injury, do not try to open or manually clean full or overfilled sharps container. And as always, refer to facility policy for using and discarding sharps containers. Now, if you experience a needle stick injury or had an exposure, please follow these steps. Wash needle sticks and cut with soap and water. Flush splashes to the nose, mouth, or skin with water. Irrigate the eyes with clean water, saline, or other sterile water. Of course, you're going to report the incident to your supervisor and immediately seek medical attention. So here's our last scenario. Let's put it all together. As part of environmental services, you're preparing to clean a trauma room after a code in the emergency department. The room is disorganized and there's a significant amount of blood on the floor. What are some things you want to consider prior to starting the cleaning and disinfection process? I'll give you guys some time to answer in the chat. So I'm seeing a lot of good responses. Tina, what PPE is needed? Danielle, ensure no loose needles are in a mess. Yep, so we're thinking about PPE, right? Where you're cleaning the blood off the floor, there's a potential for it to splash. So we would use a gown, a face protection, a mask, and gloves. We're also thinking about sharps. You know, where can they be? They might be sharps on the floor, or even around the linen, or the bed possibly. We're also thinking about safe pickup and disposing of these sharps. What if you find a used scalpel on the floor? You know, what would you do? You'll handle these sharps carefully, keeping your hands behind the sharps. Use safety devices such as tongs or forceps to pick up wayward sharps and dispose them into a sharps disposal container. Very nice job, everyone, at putting it together. Thank you for your participation. And we got a lot of really great responses on this one. Thank you. And here are today's key takeaways. So we know that standard precautions are vital to prevent the transmission of bloodborne pathogens and safeguard both the patient and ourselves. So what will we do when we see blood? We'll select our PPE based on the nature of patient interaction and anticipated exposure to blood or body fluids. We'll clean our hands appropriately as an important step to reduce the spread of these pathogens. And we'll handle needles and sharps items carefully and safely dispose of them into a puncture-resistant sharps container to prevent injuries. And here are the requirements for the certificate of training. They are a filled-out pre-session survey, attending this webinar, and completing the post-session survey. The post-session survey will be emailed tomorrow and closes November 25th at midnight, 1 week from today. The certificate of training will be emailed November 29th. Please be sure that if you're looking to receive CNE, that you complete the post-session quiz that will be emailed to you tomorrow with the rest of the post-session resources. And here is our upcoming session, Preventing Candida auris Infections, a refresher session on December 2nd by my colleague, Lisa Ledoux. Abby will be sharing a link where you can sign up for this upcoming webinar. Please join us and share widely with your colleagues. And here we have a few resources that go along with today's presentation. So on the right, we have Germs Can Live in the Blood poster. This poster you can hang in the wall at your facility, and it's a quick 2-minute read. And then on the left, we have What Should You Do If You See Blood poster. This poster you can give to your staff and discuss during a pre-shift huddle or a quick meeting. We have a microlearn that goes along with this poster as well. Abby will put the link in the chat to these resources. Please feel free to check them out. Now, if you want to be added to our distribution list for upcoming trainings, please feel free to enter your email in the chat. You can also click on a live events link through our website. Abby will also be posting these in the chat box as well. You can follow Project Firstline on social media. You can follow us on YouTube, Twitter or X, Facebook, Instagram, or LinkedIn. Here are today's references. I invite you to please take a 3-question poll on your screen. This helps us improve future sessions. I'll give you a moment for the feedback, and then we will move on over to our Q&A. Thank you, everyone.
There's a question about the reporting timeline for a needle stick. That should really be, honestly, your institution specific, but I would say contact your supervisor as fast as it is reasonable to do. Sometimes things might happen in the middle of the night and there's not a great person to call, in which case I would say first thing in the morning. But we want to get you assessed by occupational health and appropriate kind of treatment and risk stratification and all that kind of stuff done as quickly as possible. So the sooner the better. And there's a question about training opportunities aimed at school nurses within school districts. So we've actually worked with nurses, school nurses in the past, and have had some online sessions aimed specifically at them historically. We'd be more than willing to develop needed resources or do in-person trainings. The great thing about our flexible team here at Project Firstline is that we have a lot of bandwidth. We have some great experts behind the scenes that you've probably seen on our other trainings, and we can do things virtually. We can do recorded sessions. We can do things in person. So feel free to reach out, and whatever might work for your facility, let us know, and we'll see what we might be able to go ahead and develop for you guys. All right. I'm not seeing anything else. We want to be respectful of everyone's time. I think we are just at time right now. Feel free to reach out if there's anything via email. We're on social media as well, and I'll let Jacob end it.
So if there are any additional questions, please feel free to email us and we'll get back to you shortly. So I'd like to thank all of you for joining us today, and thank you for the vital role you all play in healthcare. Regardless of our functions in healthcare, we all play an important role in infection control. Take care and enjoy the rest of your day.